this is a video on aortic stenosis and its effects on the body and how you will be able to treat it. So what exactly is aortic stenosis? It is the narrowing of the heart's aortic valve. The valve can't open fully, so it prevents full blood flow to the rest of the body. Signs and symptoms. Most are usually seen only in severe aortic stenosis, but some that may be present are abnormal heart sounds or a murmur, chest pain/tightness, faint or dizzy after activity, shortness of breath, fatigue, heart palpitations, not eating, and aortic stenosis can weaken the heart, leading to heart failure. Some of the causes of aortic stenosis include calcium buildup on the valve. The calcium in your blood can collect on the valve cusp, which leads to stiffening. This can occur at any age, but usually between 70 to 80 years old. Also, rheumatic fever, a complication of strep throat that may cause scar tissue. The scar tissue alone is sometimes enough to stiffen, but also increases the chances of calcium deposits on the valve. Since the aortic valve is narrow, the left ventricle has to work extra hard to pump blood that can cause thickening and enlarging of the left ventricle. Congenital heart defect. Some people are born with only 2 cusps instead of 3, or in rare cases, 1 or 4. There is also radiation therapy. There are different types of aortic stenosis. There is congenital aortic stenosis, which is when you were born with it, such as when you are born with 2 leaflets on the valve instead of the usual 3. There is acquired aortic stenosis. This occurs later in life due to the calcium buildup. Normal valve is 3 centimeters or greater. A mild case of aortic stenosis is between 1.5 centimeters to 3 centimeters. A moderate case of aortic stenosis is 1 centimeter to 1.5 centimeter, and a severe case of aortic stenosis is 1 centimeter or less. Some complications of aortic stenosis include heart failure, stroke, blood clots, bleeding, heart rhythm abnormalities, damage to the heart, and death. There are ways to prevent acquired aortic stenosis, such as preventing rheumatic fever by seeing your doctor if you have a sore throat, or by addressing risk factors for coronary artery disease, such as high blood pressure, obesity, and high cholesterol. These factors can be linked to aortic stenosis. So who is at risk for aortic stenosis? Most common is older people, usually beginning at about age 60 with no signs, and then the signs appear at about 70 to 80 years old, or younger people with a bicuspid valve. So how would you treat aortic stenosis? There is a valve repair or valve replacement, and sometimes if there are no symptoms, the doctors will just monitor your progress. Men versus women. There are currently no known major differences between men and women when it comes to aortic stenosis. Some other important information includes that aortic stenosis is one of the most common and serious valve disease problems. In aortic stenosis, the thickening of the left ventricle causes there to be less room for blood, decreasing blood flow, and can lead to heart failure. Up to 300,000 people are diagnosed with aortic stenosis in the USA per year. The following is a list of sources that I used to help make this video. If you believe that anything in this video applied to you, please go and talk to your doctor about any symptoms that you may be experiencing.